Class is now starting. All attendees are in listen-only mode.
Welcome to our ongoing series about education for health information exchange and health information technology put on here by PMG and the Santa Cruz Health Information Exchange. I've had our mission slide up for the last 5 or 10 minutes, and you've probably gotten to see that. I wanted to also welcome our other folks that are on the call today, which include others in the community. Some of our safety nets are on the call, as well as people outside of Santa Cruz, and some of the people that support us at the state level are on our call today. So the topic is to go over the resources that are available to you and what you need to know about the changes in HIPAA related to something called the Omnibus 2013 rule. And I want to start by saying that we have managed to make all of this available to you, to anyone, at no charge. In the past, we've had HIPAA training focused from PMG that we had to charge small amounts of money for, and that's all gone. The trainings and the resources are now completely free, and part of that is underwritten by the federal government. So we hope that continues so that we don't have to charge our stakeholders any money. So the first disclaimer, given that this is a potentially legal matter, is that I'm not a lawyer, and this is not legal advice. So if you feel you need legal advice, you should seek the counsel of your attorney. So what is the HIPAA Omnibus 2013 rule? It is the third major change to HIPAA, which was initially passed in 1996 and then really went into effect for your perspective, in 2003. This rule is part of the 2009 HITECH Act, and it affects everyone in healthcare. All of the covered entities and all of the business associates that you work with are affected. Not just those people that are taking advantage of the high-tech funding, but it affects everyone. The law was published in 2011, and as the laws go, they give 2 years for a public comment and refinement. The final of this law was published in January of this year, and with a compliance date September 23rd, 2013. And I said in most cases there is one exception around the business associate agreement, and we'll cover that when we get there. And what we plan to do here is to give you the tools and links to resources so that not only can you understand what this is and how you can comply with it, but actually the tools that you can either download or click to and work through. It should take no more than a few hours for you to make your changes to be compliant with this law, but it is important that you take some actions here before September 23rd. So let's start with the training and resources. And I did want to mention that all of these slides will be available for PMG on the so-called Blue Portal in the Connecting Healthcare space. If you're not a PMG provider, they're all available on the Santa Cruz Health Information Exchange.org website, which is open to the public. So you have several places to go. You don't need to write any of this down, and these links should all work once you download the slides. So we have a couple of training resources that are new. Those of you that have been with us doing training since 2003, we've gone from in-person classroom training to online training 2 years ago by PMG, and now we are using this federal resource that was paid for by Health and Human Services called Medscape, and the links are there. There's links for your staff and links for provider training. The next thing, and we're going to go into that a little bit more in a few slides, the next thing is that we've updated the HIPAA checklist. Those of you that were involved in our earlier programs know that we came out with the checklist first in 2003. This is the successor to that checklist, and we're going to introduce that to you today. And it is also on the Santa Cruz HIE website for you to download and tailor as you see fit. One of the items of HIPAA is a requirement to do a security and risk assessment, and we're going to share this link with you to the Cal OHI website, which is part of California Health and Human Services, who's developed a really excellent, free, and very easy to use security and risk assessment template. This is not only a good idea and keeps you and your patient's data protected, but it's also a requirement if you are to be a meaningful user and get the meaningful use money. So this is a requirement that you address this somehow. We've looked at many tools. This seems to be the most straightforward. You can do this in as little as an hour, this risk assessment, if you have some of the backup material. And if you don't have the backup material, we're going to share some resources to get the backup material. The Business Associate Agreement is revised for HIPAA 2013. You must sign new business associate agreements with your business associates. So there are changes that go into effect, again, starting September 23rd of this year. Now, this is where there's a little bit of wiggle room, and that is to say, if you have recently just signed a business associate agreement, you can postpone with that business associate signing a new one for, I believe it's up to a year. My advice is just do it. Just do them all and work on this here in September. And even if you did sign a new one, say 3 months ago, get the new HIPAA 2013 Business Associate template, review it, and have it signed by your business associates. The Notice of Privacy Practices, this is big, is also revised as part of this law. We have the template that we've pulled and combined from Health and Human Services and the Medical Group Management Association, and that will also be available on both of the websites that I mentioned, both the Santa Cruz website and the PMG portal. The resource, the Information Security Policy Template, is a list of policies that you can pull in to your personnel policy, and you can incorporate those as appropriate to help you meet any of the holes that you find as you're going through our checklist. And then there's a HIPAA HHS privacy resource that's linked here. Now, if all this sounds a little bit overwhelming, it is, but we made it easy, and we're going to go through the checklist in a few moments. Finally, should you have a breach, hopefully you won't have a breach. If you do all this stuff that we're talking about here, it should reduce the possibility you're going to have a breach. But if you do, Health and Human Services has a site that helps you step through understanding what is a breach, how do you respond to a breach, who do you have to notify, and that sort of thing. If you do have a breach, you need to call your lawyer. You can call me, and if you are affiliated with us, we will talk to you. But you do need to talk to your lawyer, and then you do need to take certain steps. There are penalties if you do not take those steps. So again, if you have a breach, which is essentially the loss of control, whether it's theft or fire or purposeful sending of protected health information, then you've got a breach and you need to take action within a certain amount of time. So the free training. There's training for providers and training for staff. And the link was somewhere in one of these slides. But I'm just showing you a screenshot. It's a nice little video training with some supporting bullets over there on the right. you can see down towards the bottom that the training for providers in this case is only 23 minutes, followed by a very short test. And I passed. I did the Patient Privacy Guide for Providers, and if you take the test and you pass, which you should, it will give you a little letter of completion. You can print that out, and your practice privacy officer can file this away. And also, if you are eligible for CME, you can see here that Medscape gives you CME and keeps track of it for you. So once you're done with the testing, whether you're a provider or staff person, and whether you are or are not eligible for CME, you get this nice little report. You can go back to it any time, and you can see where you're at, and you can also view and print the certificate even if you forgot to print it the first time. So whatever you need to document your CME as well as your proof of going through the training is all here. I think the staff training was a few minutes longer than the provider, but in any case, the training is less than a half an hour of an investment. And all staff need to do this every time the law changes. So essentially, everyone needs to do this now. And here's the Medscape top level site. What you do is you go to this site and you enter HIPAA, and you'll find several trainings. Some of you may already use this site for other training. At this point, the HIPAA trainings are free and do offer the CME at no charge. That may change at some point in the future. You can see that you do need to create a login, and you can see in this one that I created a login. I'm BBHE, and I've got 1.5 CMEs. Okay, so here's your action items. So you probably have a place where you've been storing your HIPAA documents, I hope. And in 2003, if you were part of the PMG HIPAA training, we gave you a 3-ring binder with lots of nice tabs in to keep accountings for disclosure and trainings and business associates. So you know that's kind of old. You might want to just replicate that and put it into another 3-ring binder, or a paper file, or a computer, scanner, high-tech, however high-tech you want to be, but create a new place for your HIPAA 2013 checklist and documentation. And because you could get audited, and I believe you need to keep these files for up to 6 years, you should keep your old HIPAA binder or documentation. Don't get rid of it. Also, some of the things that you've done in the past will come forward and satisfy the 2013. So keep that for comparison, but do start that. The next step is start and complete the new HIPAA 2013 checklist. We're presenting our version of that here on the next slide, but you might have one from another HIPAA resource that you've worked with, or maybe your organization has its own. But it's important that you organize in a checklist fashion the things that need to be done. Second, and you'll see this as part of the checklist, is perform a HIPAA security and risk assessment. That's the nifty California Health and Human Services tool that is online, and you can go through that and print it out when you're done. It also retains it, so you can keep going back and updating it or adding to it as you get your act together there for that piece. You'll want to verify that your policies and procedures for yourself and your staff and your doctors are all up to date and consistent with the 2013. And you want to do the training for everyone at those resources. So I'm going to show you just the first 15 items on the checklist here. We're not going to go over them in any great level of detail, but it's something that you should be able to, answer the questions that you know now, fill in the blanks or fill in the things that are options, like number 6, the practice does have or does not have a website and the address. don't forget that you need to upload a copy of your new HIPAA 2013 Notice of Privacy Practices to that site. That's a legal requirement. And so that's the whole idea behind these 30 items, is to help you stay compliant with the laws, so that if you were ever audited, that you'd be able to pull out your binder or your electronic folder and you'd start with your checklist, and the auditor would go right down this and would, and if you have these things answered truthfully and you have documentation to back them up, your HIPAA audit should go really smooth, and they'll be out of your hair in no time at all. On the other hand, if you don't have this documented, they're going to keep bothering you and drilling in until you get them satisfied, and that's not pretty. So in any event, that's the beginning of the checklist, and I know some of the practices are pretty large, and you may have to create new forms, new lists, and things like that, but this should give you a good starting point to get through these 30 questions. And one other thing, I don't see it here, but some of the questions, I guess beyond number 15, have an asterisk. And what that means is that item is more fully covered in the security and risk assessment process. So you're going to want to answer it here. It's just a quick answer, but you'll see it repeated. Things like all of my computers are protected by antivirus. So you'll see that here somewhere, and that's also something that you'll be talking about again and documenting in your security and risk assessment. So we just went through the checklist overview. You can go to one of our sites and download the checklist. You can download this document. You can download the business associate agreement. And we're just about finished with the review in the next few days of the Notice of Privacy Practices, and we'll be posting that as well. Coming up next is we're going to be scheduling another session to update you on what's coming in Meaningful Use Stage 2, which for most of you takes effect October 1, 2014, along with ICD-10. So it's going to be a busy 12 months. It's going to take months of preparation on your part to make the changes and work with your vendors or with us or us and your vendors to get your systems up for Stage 2. So we're going to take you through that, and we're also going to be scheduling some PHR, some personal health record webinars around patient engagement, which is both a Stage 2 meaningful use requirement, as well as an opportunity for you to connect more with your patients and have them connect more with you, so that we can improve the health care of all of the people in our area. So with that, I want to thank you for joining, and we will talk to you soon.